Thank you, Mr. Chairman, and thank our witnesses for being here. Dr. Upton, what steps are currently being taken to modernize CHAMP VA's claim filing system to prevent substantial delays in processing claims?
Thank you, Congresswoman. As you know, CHAMP VA is a very important part of our commitment in VHA to honoring our family members, survivors, and caregivers. As this program has expanded, it's clearly shown us the need that we need to modernize based on feedback from the beneficiaries who use the system. To answer your direct question, we've heard very clearly that the process of submitting applications for eligibility is done solely in paper right now and requires time and reviews to process, as well as beneficiaries, when they submit claims directly, those have to come in paper as well. By the end of this calendar year, we are aiming to have an online form available for submission for eligibility as well as claim submission. We're also working extensively on modernization of the whole enrollment and eligibility process, and we'll certainly keep you updated.
Thank you. How is the VA addressing the issue of, as a provider, the issue of prolonged payment delays to community providers under CHAMP VA, and what measures are in place to expedite these payments?
Sure, thank you. Yes, in order to manage this program and serve that commitment to the beneficiaries we serve, we have to be able to pay providers timely. It's something that's critical in order for providers to be open to see our patients, as well as for beneficiaries not to receive bills. What we've done in the CHAMP VA program is work to modernize how we process those healthcare claims from providers. Instead of having a human have to touch and review every claim, we're now auto-adjudicating 92% or more of claims that come to us electronically from providers, paying most of those within 30 days, often within 7. But we know there's more work to do, and continually want to reach out to our provider community to make sure we're paying timely and their questions are answered.
So if you're auto-adjudicating or using AI to determine claims, can you also keep us updated on the percentage of denials?
I'd be happy to update you on the denials.
Okay. And given your answer to the first question about moving from paper applications to an online form, can the VA provide data on the average time frame for resolving backlogged payments and applications, and the steps taken to prevent, I think you've already mentioned, to prevent such backlogs, so that you can track before implementation and then after implementation?
Absolutely. We will track that, and it's very important for transparency to you and those we serve.
So then we can follow up next year or the year after.
Absolutely.
Regarding the wrongful denials of necessary healthcare services, what's the VA's process for reevaluation of denials and recertification of such cases, and how can this process be made more transparent and accountable?
Sure. For the bulk of CHAMP VA care, as opposed to other programs we run that provide care in the community, CHAMP VA typically does not require pre-authorization or pre-approval from VA. But in instances where there is a denial or there is a payment that provider feels that should have been made, we have a contact center with representatives that can work with providers and beneficiaries. What we've noted as we work to modernize this system is that the beneficiaries that use this system could benefit from further coordination for their care with providers, especially in higher sensitivity or high risk types of care. So we are working on better coordination and putting a team in place that can help as the next phase of maturity in the system.
And you may have already answered this question, but very briefly, how does the VA plan to address the systemic administrative issues within CHAMP VA to improve overall integrity of the program and better serve one of the most vulnerable segments within the military community?
Very important, and it's one that we want to do systemically from the start of beneficiaries learning about the program, from the enrollment process through the payment, as you mentioned, and through the data we talked about earlier, as well as other steps. We're committed to transparency, listening to our beneficiaries, and working with this committee to make sure that you see what we see and we get it right.
And then, Honorable Jacobs, in response to one of your answers to a previous question, you had mentioned that to Ranking Member Takano that the information you're receiving, perhaps, and you're going to meet with TAPS or other organizations, that your responses have been very favorable, but you're hearing something different. So have you thought about doing a follow-up survey after people have reached out, and then looking at the follow-up survey to see if, in fact, and it could be randomized, done, to see if, in fact, your services are reaching those or your outreach is beneficial?
We are, and we're looking at it both from a qualitative and a quantitative perspective, because when you get quantitative surveys, you often are limited in terms of what you can glean, but when you actually talk to individuals, you get a much richer perspective. And so that's what this, the survivor experience project is all about, and it's why I've asked my team to follow up, and I'll be part of some of these conversations as well with organizations representing survivors.
Thank you, and I yield back.